Cupping is not used over any organ except one, the lungs. The lungs are the one place that it seems to be okay because it has the ability to pull out accumulation from the lungs. If we think about the lungs as the master of chi, we're helping the chi move. So what does cupping do? Primarily regulates chi and blood. Helps move both blood and lymph circulation in the body. Has the ability to stimulate nerves in the skin, okay, especially sensory nerves in the skin, and it will help regulate the autonomic nervous system. The thing you have to remember about cupping is that it exhausts the patient, typically. Because you're moving a lot, you're pulling stuff out. It's almost like you're traumatizing the patient a little bit in one way. It's like you're traumatizing the area inside a little bit. You're moving things, you know. It's kind of this suction, it's pulling, you know. So it's a little bit traumatic. It's not like giving a nice gentle massage to somebody. Contraindications, allergic skin reactions, bleeding disorders. Makes sense, right?
What if they have like eczema and they're having like a flare up in a certain area? Would you want to avoid
I mean,
that?
it may exacerbate it potentially. The thing is though, you don't, especially if anything is potentially contagious, you don't want to contage another part of the body, you know. So
just avoid kind of those kind of things as
that's
well.
kind of the idea. You know, when you're dealing with those things, acupuncture is really good. Probably some kind of external liniment or herbs is probably a better way to go than cupping. Always explain procedure and all side effects to the patient. There's something called Part Q. I think I mentioned it in our orthopedic anatomy. Procedure, alternatives to that, risks, and then any questions. It's a little out of order there, but you say, this is what I'm going to do. There are alternatives to it. These are the risks. Do you have any questions? It's typically a C&T thing that you have to follow. It is important to tell people possible risks. You're going to notice possible bruising, shaw, pain. It's going to be on your skin for a week. Are you okay with that? Are you going to the beach tomorrow? You know, I've had women I was going to cup and they said, you know, I'm going to be in a wedding in 4 or 5 days. Is this going to leave a mark?
Yeah.
It may or may not. It may be gone in 1 day. Some people it's gone in 1 day. I've had people, I've cupped them, they'd come back 2 weeks later and the cups are still there. But, yeah. So some people take a long time to really just move things through. You let the patient know if you're going to be stationary or moving the cups around. Really important. You know, the patient needs all the information. Important to tell patients you're using fire cupping, that you are lighting a fire. You know, there are some people that fear about fires, so or they're afraid you're going to burn them, so don't worry. But careful to take patient history to identify diabetes, neuropathies, or other conditions that may limit a patient's response to pain or ability to feel. You're going to see patients who have diabetes who don't feel anything in their foot. Cupping can cause problems with the tissue underneath, so you have to check in with them, obviously. Cupping should be applied on clear skin only. Don't put it on over any active lesions, obviously. Prolonged cortisone can make the skin thinner and more prone to breakage from cupping. There's a lot of people on long-term cortisone shots or they're taking it, so you have to be careful about that.